My reaction, and I think his reaction, was not why me, but why not us? Because you live as long as we have, and we've seen a lot of people go through a lot of things, and some people seem to get more than their share of things, and you wonder, why are they getting all that? So we sort of dealt with it in that way. It was my husband, and it was 7.5 years ago, and he was in very fine health. He felt very, very well, and he had a routine blood test, following something or other, and it was he who saw the anomalies in his test, his blood work. They also did have a pre-transplant training session, and which we attended together. And there were quite a number of people in the room. There were presentations by nurses, by physicians, by the social worker. They go over everything. When you read the literature, it tells you everything that can happen. You're going to get mouth sores, you're going to get foot sores, you're going to get this, you don't get all that stuff. The worst part for me personally was when he came home, because you leave your little bubble of, being cared for, and you read all, you read the information. He might not be able to walk up the stairs. He might, this might, that might happen, The hardest part for me was you really do become a tech in a way. You have to do the, we had that port, and I had to deal with a lot of the, the dosage of the medication, and it wasn't easy. And when I say crying, I wasn't hysterical, but I was basically saying, I can't do this. If I wanted to be a nurse, I would have gone to nursing school. We were very supported, very, very supported, very supported. But I think of people who don't have those supports. What happens? You could never pay for this kind of care. So I don't know what happens to people who have insurance, but not great insurance. I don't know what would happen to them. I feel for the people who don't have both the intellectual, financial, benefit, resources that we had. How do they navigate all of this? Because it's a big deal. It's a very big deal. For people who are in that situation, I don't even know if they have the wherewithal to ask and to get what they need. So they would need to be reached out to. Somebody would have to probe more deeply, because if we needed something, we knew how to navigate the system and how to get what we needed. But I don't think everybody, leukemia doesn't, you can be anybody and get leukemia. Maybe more outreach and helping people understand what they need, because I don't think they always know what they need.